It's one of those things that can happen to anyone, anywhere. One second you're moving along, and the next, a sudden, sharp pain in your leg brings everything to a dead stop. Today, we're going to dive into what's happening in those critical first few minutes right after a serious leg injury. And that sound, oh man, that snap or pop, there's just nothing else like it. It's the exact moment a great day can turn into a pretty serious situation. So, what is actually happening inside your body right then? And more importantly, what are the first steps that can make all the difference for your recovery? So, at the most basic level, we're usually talking about a fracture. That's just the medical term for a broken bone. But what's really fascinating is that the second a bone breaks, your body's healing process kicks into gear. The area bleeds inside, and this creates something called a hematoma. Think of that collection of blood as the foundation, literally the first building block your body lays down to start making new bone. All right, so here's how we're going to break this down. We're going to start by seeing things from a first responder's point of view. Then we'll take a quick tour of the leg from hip to ankle. After that, we'll get into the super important principles of splinting, and then we'll wrap up with what your role in all of this really is. Okay, so let's imagine a first responder arriving on scene. They see someone in a lot of pain, obviously hurt. What's the very first thing they're going to check? You might be surprised it's probably not what you're thinking. And this is absolutely key. Their first concern? It's not the bone, not at all. It's the stuff around the bone, the plumbing and the wiring, if you will. Before they do anything else, they have to know if the nerves and blood vessels are okay. See, a broken bone will heal, but a limb that's not getting blood or nerve signals is in major, major trouble right now. And they figure this out with a super simple but vital check called CMS. C is for circulation. Pretty straightforward, right? They're looking for a pulse in the foot, way down past the injury. M is for movement. Can you wiggle your toes? That tells them if the nerve signals are getting all the way down. And S is for sensation. Can you feel me touching your foot? It's a quick 3-part test that gives them a snapshot of what they're dealing with. Okay, so now that we know what rescuers are looking for first, let's get a little more specific. We're going to do a quick anatomical road trip, starting at the hip and working our way down, pointing out the classic signs of some really common injuries. Okay, check this out. For two very different hip injuries, the leg often looks shorter, but the giveaway, the big clue, is which way the foot is pointing. With a hip fracture, the leg tends to roll and point outward. But with a posterior hip dislocation, where the ball pops out of the back of the socket, the leg rotates inward. It's a classic telltale sign. And that inward rotation is a huge clue because, get this, over 90% of all hip dislocations are posterior. The classic way this happens is in a car crash, where your knee slams into the dashboard. That force drives the femur straight back and pops it right out of the socket. So why is this such a massive deal? A dislocated hip isn't just a bone out of place. No, this is a real deal orthopedic emergency. It's a ticking clock. The blood vessels feeding the top of the femur can get pinched or even torn. And if that blood supply is cut off for just a few hours, the bone tissue can actually die. Moving on down to the femur, we're talking about the longest and strongest bone in your entire body. To break this thing takes a huge amount of force, and the signs are, well, they're dramatic. We're talking intense pain, massive swelling, you might see a clear bend in the thigh, and sometimes what's called false movement, where the leg literally moves in the middle of the bone. And because this bone is so big, breaking it can cause life-threatening internal bleeding. Now at the knee, it is so important to know the difference between two injuries that sound the same but are worlds apart. A patella or kneecap dislocation is pretty common. It's when the kneecap pops over to the side. Super painful, but not usually a threat to your leg. A true knee dislocation, on the other hand, is a rare, catastrophic event where the whole joint, the tibia and the femur, separates. This is an absolute emergency because it can shred the major artery right behind the knee, cutting off all blood flow to the lower leg. And finally, in the lower leg, we have the shin bone, or tibia. And the big worry here is something called an open fracture. See, the front of your shin bone is right under the skin. There's not much padding. So when it breaks, it's really common for a sharp bone end to just punch right through the skin. This is an immediate emergency, not just because of the wound, but because you've now introduced all the bacteria from the outside world directly to the bone, and that creates a huge risk for a really bad infection. So we've seen all these pretty serious injuries. What's the number one thing we can do in the field? It all comes down to splinting. But why is just holding a broken limb still so incredibly important?
I love this quote from our source material because it's so simple and direct. Immobilization just means holding things still. That's it. And by doing that, we stop those sharp, broken bone ends from grinding around and tearing up more muscles, nerves, and blood vessels. It also helps a ton with the pain and gives the bone the stable home it needs to start healing.
Okay, quick vocabulary lesson because these two words get mixed up all the time. Tension and traction. Tension is just a stretching force. It's often what causes the injury in the first place. Traction is a medical treatment. It's when we deliberately and gently pull on a limb to help get the bones back in line. This is a huge deal for pain relief because it fights against those powerful muscle spasms that happen when a big bone breaks. So, what are the golden rules for applying a splint? Well, first, you have to lock down the joints above and below the break. No exceptions. Next, you gotta pad all the empty spaces so it's nice and snug. Then, and this is critical, you check that CMS, circulation, movement, sensation, before you put the splint on and after to make sure you didn't make things too tight. And of course, if there's an open wound, you cover it with a clean dressing first.
And that brings us full circle, right back to that femur fracture. A special device, a traction splint, is made for this one specific injury. Why? Well, remember how powerful those thigh muscles are? When the femur breaks, they spasm and pull the broken ends right past each other. A traction splint provides that steady, gentle pull that's needed to overcome those spasms, line the bone back up, and get the pain under control. All right, let's pull all these pieces together in our final section. What's the big picture here, and what does all of this actually mean for you?
We've looked at the anatomy, the assessment, the treatments. After all of that, what's the core mission? What's the most important thing to take away from these critical first 10 minutes?
At the end of the day, your goal is not to be a doctor on the scene. It's much simpler and honestly just as vital. Your mission is, 1, to prevent any more harm by keeping things stable. 2, provide comfort and reassurance. 3, use what we've talked about to recognize when something is really serious. And 4, get that person ready to be moved safely by the pros when they get there. And this is the real power of this knowledge. Understanding why a paramedic is checking for a pulse in your foot or why they are so focused on keeping your leg perfectly still, it makes you a way better helper if you're a bystander. It makes you a more informed and empowered patient if it's you who's hurt. It makes you a critical first link in that chain of survival. So, I'll just leave you with this question. Now that you know the why behind what's happening in those first 10 minutes, what's the one thing that's really going to stick with you? What's the one thing you'll remember if you're ever there when it happens?